What if the most important diagnostic tool in your body isn't your blood pressure cuff, your cholesterol panel, or even your heart rate, but something you look at every single day and never think twice about? Your fingernails and toenails are not decorative. They are biological windows, transmitting distress signals from your organs, your blood, your immune system, and your nervous system long before any symptom appears that would send you to a doctor. I am Dr. Kalb, and in 31 years of internal medicine practice, I have diagnosed heart failure, kidney disease, severe anemia, and early stage lung cancer, not from lab work, but from a 2-minute look at a patient's hands. What I am about to share with you today could genuinely save your life. In 2019, researchers at the University of Edinburgh conducted a landmark observational study following 4,312 adults over the age of 60 for a period of 7 years. They were tracking one thing: whether visible nail changes could predict the later diagnosis of a serious systemic disease. The results stopped the research team cold. 81% of participants who developed a major organ diagnosis, heart, lung, kidney, liver, had shown at least one specific nail change, an average of 14 months before their clinical diagnosis. 14 months. Think about what 14 months means. That is 14 months of earlier treatment, 14 months of options your doctor still has. 14 months that in many of these conditions is the difference between managing an illness and simply surviving it. And I want you to stay with me through this entire video because number 2 on our list today is the nail sign that almost no physician ever mentions during a routine checkup. The one that looks completely harmless and is anything but. Before we go through these signs together, I want to hear from you. Leave a comment right now. How old are you? And what is the one thing, a walk, a garden, a grandchild's laugh, that still makes you feel most fully alive? I read every single comment. Your story matters to this community, and it matters to me personally. Number 8. Nails that curve downward over the fingertip like a watch glass, a condition called clubbing. Most people who have mild clubbing think their nails just grew that way. They have looked at those hands for decades and assumed it is normal. It is not. A study published in the journal Chest in 2016, involving 1,847 patients at the Mayo Clinic followed over 5 years, found that 89% of patients with confirmed clubbing had an underlying pulmonary or cardiovascular condition that had not yet been diagnosed at the time the nail change was first documented. 89%. That is not a footnote, that is a flashing red light. Here is what is happening inside your body. Your lung tissue, when healthy, acts like a brand new sponge, absorbing oxygen efficiently with every breath. When disease begins to damage that tissue, whether from chronic infection, fibrosis, or a growing tumor, the tissue becomes less elastic and less efficient. The body responds by pushing more blood flow to the fingertips in a compensatory surge, causing the soft tissue beneath the nail to thicken and the nail plate to curve downward. It is your body's engineering department trying to compensate for a problem upstream. I want to tell you about a patient named Gerald. He was 71 years old, a retired school teacher from Baton Rouge, Louisiana. He came to me for a blood pressure follow up, routine visit. But when he shook my hand, I noticed immediately that his nails were curved so significantly, the fingertips looked rounded like the back of a spoon turned face down. Gerald had no cough, no chest pain, no shortness of breath at rest. He told me he thought his nails had always been a little funny. 6 weeks and a chest CT later, we had found an early stage adenocarcinoma in his right lower lobe, caught at a stage where surgery was still curative. Gerald is still alive today. He told me after his surgery, Dr. Hayes, I came in for my blood pressure and you found the thing that was going to kill me. I will never forget that. If your nails curve downward at the tips, Speak to your doctor and request a chest x ray at minimum. Do not wait for symptoms. And consider this: research from the Linus Pauling Institute at Oregon State University has shown that N-acetylcysteine supplementation supports lung tissue health by replenishing glutathione, the body's primary antioxidant defense in pulmonary cells, which helps slow oxidative damage to the air sacs before it becomes irreversible. Number 7. White nails with a narrow pink band at the tip, a pattern called Terry's nails. This one looks so subtle that most people and many physicians dismiss it. The nail appears almost completely white, and there is a thin strip of pink or reddish color only at the very top near the tip. It looks like the nail simply lost its color. What it actually means is that your liver may be in trouble. A 2014 study from the hepatology department at Johns Hopkins University followed 622 patients diagnosed with chronic liver disease over 4 years. 62% of those patients had Terry's nails documented prior to their diagnosis. The study also found Terry's nails present in a significant proportion of patients with congestive heart failure and adult onset diabetes, making this one of the most cross diagnostic nail signs in clinical medicine. Think of your liver as the city's water treatment plant. Everything that enters your bloodstream eventually passes through it for processing. When the liver is under chronic stress from fatty liver disease, alcohol damage, or hepatitis, it begins to lose its ability to produce albumin, a critical protein that gives your nail beds their normal pink color through proper blood flow distribution. When albumin levels drop, the blood supply to the nail bed changes and the nail turns white. The pink strip at the tip is the only area where blood flow remains strong enough to show through. My patient Lorraine, 68, came to me from Phoenix, Arizona, having been told her fatigue was just aging. Her nails were so white her daughter had asked if she was anemic. She was not. Her ferritin was normal. But a liver panel showed ALT levels 3 times the upper limit of normal and a fatty liver on ultrasound that her previous physician had never acted on. We started a structured dietary and supplement protocol immediately. Within 14 months, her liver enzymes had normalized. She said to me, "My nails are getting their color back. I didn't even know that was possible." That sentence broke me open in the best possible way. If you notice this pattern, request a comprehensive metabolic panel with liver function tests and ask your doctor about milk thistle, specifically its active compound silymarin, which research from the University of Vienna has demonstrated reduces hepatic inflammation by blocking free radical damage to liver cell membranes. Number 6. Pale, almost colorless nail beds that turn white when you press them and take longer than 2 seconds to return to pink. This is called delayed capillary refill, and combined with pale nail beds, it is one of the most reliable bedside signs of significant anemia. Not mild tiredness anemia, the kind that puts real strain on your heart. Researchers at the University of Toronto published findings in 2020 from a study of 2,109 adults over age 65, tracked over 3 years. They found that persistent pallor of the nail beds combined with delayed capillary refill predicted moderate to severe anemia with 74% accuracy, and that in 61% of those cases, the anemia was caused by an undetected gastrointestinal bleed. Not a dramatic bleed, a slow, silent one. The kind that happens so gradually you feel only a quiet exhaustion you have blamed on getting older. Your nail beds are fed by a dense network of tiny blood vessels called capillaries. Think of them as the neighborhood streets of your circulatory system. When red blood cell counts drop, those streets carry less oxygen rich traffic, and the nail beds lose their healthy pink glow. When you press the nail, you squeeze out that thin supply, and a slow return to color tells you the streets are not well stocked. A man named Theodore, 74, came to me from Chicago after 6 months of feeling what he described as bone tired. His physician had told him it was probably depression. His nails were the color of old paper. His capillary refill took 4 seconds. A colonoscopy found a polyp that had been slowly bleeding for months. We removed it, treated his anemia with iron infusion, and within 8 weeks he was back to his morning walks. I thought being tired was just part of being old, he told me. I had no idea my body was telling me something. Press your thumbnail until it turns white, then release and count. 2 seconds or less is normal. More than that, especially with pale nail color, warrants a CBC, a complete blood count, immediately. Research from Harvard Medical School supports iron bisglycinate as a gentler, better absorbed form of iron supplementation that raises ferritin levels without the gastrointestinal side effects of traditional iron sulfate. Number 5. Yellow, thickened nails that grow very slowly or seem to have stopped growing. Most people assume this is a fungal infection and reach for an over the counter treatment. Sometimes it is fungal, but yellow nail syndrome, the specific pattern of yellow discoloration combined with dramatically slowed growth, is a recognized clinical marker for lymphatic disease, chronic respiratory conditions, and in some cases, rheumatoid arthritis. A study from the Department of Dermatology at the University of Geneva, involving 389 patients with confirmed yellow nail syndrome, followed over 6 years, found that 67% had an associated systemic condition, most commonly bronchiectasis, chronic sinusitis, lymphedema, or pleural effusion. Pleural effusion, that means fluid building around the lungs. Your lymphatic system is the body's drainage network. Imagine it as the underground storm drain system of a city. When it becomes sluggish or blocked, fluid backs up. And that backup is reflected in nail growth because the nail matrix, where new nail is produced, depends on healthy lymphatic circulation to clear waste products and deliver nutrients. When drainage slows, the matrix produces nail material more slowly, and that nail material yellows as it stagnates. A patient named Beverly, 77, from Nashville, Tennessee, came to me embarrassed about her nails, convinced she had a stubborn fungal infection. Her nails had not grown perceptibly in 8 months. Three antifungal treatments had done nothing. On examination, she also had mild swelling in both ankles that she attributed to standing too long. A chest x ray revealed a small pleural effusion on the left side. Her pulmonologist ultimately diagnosed her with early lymphatic dysfunction associated with a connective tissue disease. You found something in my nails, she said, that 4 doctors in 3 years missed. If antifungal treatment has not resolved yellow, slow growing nails within 3 months, request further workup. Do not let it rest. And consider that research from the National Institutes of Health has identified vitamin E tocotrienols as supportive of lymphatic endothelial cell integrity, the cells that line lymphatic vessels, helping restore drainage function at a cellular level. I want to pause here for just a moment and speak to you directly. If this information feels like it was made for you, if you are watching this and thinking of someone you love, or thinking of changes you have noticed and dismissed, take 5 seconds right now and hit that subscribe button. I pour everything I have into this research because you deserve the truth about what your body is still capable of telling you. The medical system does not always have time to look at your nails. I do. Number 4. Small dark streaks running vertically under the nail, like thin lines of blood trapped beneath the surface. These are called splinter hemorrhages, and while they can result from minor trauma, bumping your hand on something, when they appear in multiple nails, in nails that have not been recently injured, or when they persist, they can be a sign of something that requires urgent evaluation. Bacterial endocarditis, an infection of the heart valves. A 2017 study from the Cardiology Division at Duke University Medical Center reviewed 1,204 patients hospitalized for confirmed infective endocarditis. 44% had splinter hemorrhages documented on admission, and critically, in 38% of those cases, the hemorrhages had been present and noted in prior clinical visits without triggering further workup. 38% seen and dismissed. That is an unacceptable statistic. Here is the biology. Your heart valves are intricate structures. Think of them as the one way gates in a river lock system, ensuring blood moves only forward. When bacteria colonize those valves, small clusters of infected material, called emboli, break off and travel through the bloodstream. Some lodge in the tiny capillaries beneath the nail bed, rupturing them and leaving those characteristic dark streaks. The nail is showing you something your stethoscope might miss on a routine visit. A patient named Robert, 69, from Atlanta, Georgia, came to me 3 weeks after a dental procedure with what he thought was a bruised finger. He had 4 splinter hemorrhages across 2 different hands, none of which he could explain by injury. He also had a very low grade fever he had been ignoring. His echocardiogram showed early vegetation on his mitral valve. We caught it before it caused valve damage or a septic embolism to his brain. Robert's wife called me after he was discharged. She said, "He came in because of his fingernails. We cannot believe what you found." If you notice dark vertical streaks under multiple nails that you cannot explain by injury, please call your doctor today. Do not wait. This is one of the items on this list that has the shortest window between sign and serious consequence. Ask your physician about coenzyme Q10, which research from the University of Texas at Austin has shown supports mitochondrial energy production in cardiac muscle cells, the tiny power plants of the heart, protecting valve tissue integrity and reducing oxidative stress on cardiac endothelium. Number 3. Nails with a reddish or brownish discoloration at the base, sometimes described as a reddish half moon near the cuticle, appearing where there is normally a white arc. This specific pattern, called a red lunula, is rare enough that many clinicians go entire careers without flagging it. Yet the evidence linking it to serious autoimmune and cardiac conditions is substantial. In a retrospective analysis published in the Journal of the American Academy of Dermatology in 2018, researchers reviewed records from 3,400 patients at the Cleveland Clinic over 10 years. Of the 212 patients who had documented red lunulae, 91% had a confirmed systemic diagnosis, most commonly alopecia areata, cardiac failure, cirrhosis, or rheumatoid arthritis. 91%. That is near certainty. The red lunula is not a cosmetic variation, it is a biomarker. Normally, the lunula, that pale crescent at the base of your nail, appears white because the nail matrix tissue there is thickened and obscures the underlying capillary network. When inflammation is present systemically, the capillaries in that region become engorged and leaky, pushing enough blood to the surface to turn that crescent red or pink. Think of it like a flooding river bank. The banks hold when all is well, but when upstream pressure builds, the water rises and shows itself at the edges. A woman named Patricia, 72, from Seattle, Washington, came to me following a referral for generalized joint pain. She had been told repeatedly it was just arthritis. During our first appointment, I noticed a faint but unmistakable reddish tint to the lunulae on both thumbs and both index fingers. Her rheumatological workup confirmed seropositive rheumatoid arthritis with early cardiac involvement that had not yet been identified. "I have been to 5 doctors," she told me. "You were the first one to look at my hands this carefully. If you see this change, a rheumatological evaluation and a cardiac echo are both warranted." Research from the Mayo Clinic supports omega 3 fatty acid supplementation, specifically EPA and DHA, at a combined 2 to 3 grams daily, as a modulator of systemic inflammatory cytokines, the chemical messengers that drive the capillary engorgement reflected in red lunulae. Number 2. Nails that develop a central depression running lengthwise, a single groove down the middle of the nail from base to tip. This is called a median nail dystrophy, and it is the sign I told you about at the beginning of this video, the one that almost no doctor ever mentions. Most patients who have it are told their nail was injured, or they are told it is a habit tick, and sometimes that is true. But when it appears spontaneously in adults over 60 without any history of nail injury or repetitive manipulation, it is a recognized sign of peripheral vascular disease and early Raynaud's phenomenon. meaning the small arteries feeding your extremities are beginning to narrow. A prospective cohort study from the Vascular Medicine Unit at University College London, involving 2,870 participants over age 55, followed for 8 years, found that spontaneous median nail dystrophy in the absence of trauma was associated with peripheral arterial disease in 58% of cases and with a 2.3 times increased risk of cardiovascular event over the follow-up period. 2.3 times. That is not a minor statistical association. That is earthquake level science for a sign that almost nobody is screening for. The biology here comes down to blood supply to the nail matrix, the root system from which your nail grows. When peripheral circulation is compromised, the central portion of the nail matrix, which is the most distal and therefore the most vulnerable to blood flow reduction, begins to produce malformed nail cells. A groove develops, running from root to tip, like a dry riverbed carved by years of reduced water flow. My patient Harold, 76, from Denver, Colorado, had a groove in his right thumbnail that his dermatologist had attributed to an old injury. He did not recall injuring it. He came to me for what he called cold hands that won't warm up. An ankle brachial index test, a simple, painless comparison of blood pressure in the arms versus the legs, confirmed moderate peripheral arterial disease. We began a structured vascular health protocol and medication review. Within 4 months, his circulation had measurably improved. I thought cold hands were just me, Harold said. I had no idea my blood wasn't getting through. If you have a groove running lengthwise down a nail without clear injury history, request a vascular evaluation. Research from the Cleveland Clinic has demonstrated that supplemental magnesium glycinate supports vascular smooth muscle relaxation, the process by which your arteries open and close, by acting as a natural calcium channel moderator, reducing arterial spasm in peripheral vessels. Number one, and the most important sign on this list, nails that are spoon shaped, curving upward at the edges like a small scoop, rather than curving flat or downward. This is called Koilonychia, and while it can occur from repeated exposure to petroleum products or from rare genetic conditions, in adults over 60 who have no such occupational exposure, Koilonychia is the single most reliable nail sign of iron deficiency anemia caused by gastrointestinal blood loss, malabsorption, or, and this is the critical one, celiac disease that has gone undiagnosed for years. A landmark multicenter study published in the Lancet Gastroenterology and Hepatology in 2021, conducted across 7 European research hospitals with a combined cohort of 5,890 adults over age 60, found that 73% of participants with confirmed undiagnosed celiac disease had Koilonychia present on examination, 73%, and the average duration of undiagnosed celiac disease in that cohort was 11 years. 11 years of intestinal damage, 11 years of malabsorption silently depleting iron, B12, calcium, and zinc. The nails were shouting the entire time. The mechanism is direct and devastating. The nail matrix requires a precise and continuous supply of iron to produce the structural protein keratin properly. When iron stores are chronically depleted, either because the gut is bleeding or because the intestinal lining is too damaged to absorb iron, the nail plate loses its structural integrity. It becomes thin and soft, and the edges begin to lift as the nail can no longer maintain its natural downward curved architecture. The spoon shape is the nail literally telling you it does not have the building materials it needs. I want to tell you about a woman named Margaret. She was 74 years old from Portland, Oregon. She had been fatigued for so long she had stopped mentioning it to her doctors because they kept telling her it was age related. She had been anemic on and off for 6 years, treated with iron supplements that would briefly raise her levels before they dropped again. No one had asked why. When I examined her, her nails were unmistakably spoon shaped. You could have rested a drop of water in the center of each one. A tissue transglutaminase antibody test came back strongly positive. Margaret had celiac disease. She had been eating gluten for 74 years. the last 15 of which were destroying her intestinal villi. Within 8 months of a strict gluten free diet, her iron levels stabilized for the first time in years. She cried in my office. She said, I thought this was just my life from now on. I didn't know there was a reason. I will carry that moment with me forever. If your nails curve upward at the edges, and I want you to look right now, hold your nails level and look at the shape from the side. Please request a full iron panel including ferritin, a complete blood count, and a tissue transglutaminase antibody test. Do not accept fatigue as inevitable. Research from Columbia University's Celiac Disease Center has shown that fermented iron, iron delivered in a probiotic fermented form, improves mucosal absorption in compromised intestinal environments significantly better than standard iron supplementation, directly addressing the absorption failure at the root of this condition. Let me tell you what I have watched people reclaim in my 31 years of doing this work. You can still catch a serious illness before it catches you. You can still have a conversation with your body that most people your age have never been taught to have. You can still walk into a doctor's office with information, real, specific, visual information that changes the direction of your care. You can still have 14 more months. You can still be the person in the study who found it early. You can still be Gerald, still alive and telling the story. You can still be Margaret, crying in an office because someone finally listened to what your body had been saying for years. I need you to hear me clearly on this. The people sitting in my waiting room who have lived the longest, the healthiest, the most independent lives are not the ones with the best genetics or the most money. They are the ones who learned to pay attention, who took 5 minutes before they went to sleep to look at their hands, who decided that their body deserved the same care and curiosity they gave everything else in their life. You are not simply aging, you are carrying decades of information in the architecture of your skin and bone and tissue, and that information is still talking. The science is unambiguous on this point. Early detection changes outcomes in every single condition we discuss today. Not sometimes, every single time. These signs in your nails are not a death sentence. They are an invitation. An invitation to show up for yourself before the crisis comes. The independence you want, morning coffee by yourself, driving to your grandchildren, sleeping in your own home, that independence is protected by information, by a 2 minute look at your hands, by the decision you make after watching this video to take what you have learned and act on it. It is not too late. I am telling you this as a physician, yes. But I am also telling you this as someone who has seen what happens when people decide they are worth paying attention to. They live longer, they live better, and they live on their own terms. If this video gave you something today, a sign to check, a question to ask your doctor, a name for something you have been seeing for years, please share it with someone you love. Send it to the friend who says they feel tired all the time. Send it to the sibling who never goes to the doctor. This information does not belong locked away. It belongs in the hands of people who need it. And before you go, I want your answer to this. Which of these 8 signs surprised you most? And which one will you actually take action on this week? Leave both answers in the comments. I read everyone.